I bring in now Professor Dr. Susan Armijo Olivo. So you are a professor for physiotherapy in Osnabrück, and you are the latest asset, if I may call you that, to one of our universities, as certainly, you know, at this group we are having this afternoon, because you only moved here 2 years ago. And so I want to pick up on this support, not just supporting students, but also supporting professors like yourself to set up in Germany. I mean, it's quite a hike, you know, to have, you know, get to know a new country, get to know a new system and everything. If we could start off by having you tell us how you found this opening in Osnabrück, first of all, and then also how you how this you know, application process worked for you personally.
Okay, so I just have to tell that my husband is Austrian. So we were both in Canada. We did our graduate school in Canada. And the first thing is that I wanted to move back to my country, to Chile. But it didn't work out because my husband had a very specific area of research, and Chile was actually not very good. And then we say, okay, we look Europe, because we actually didn't want to stay in Canada. We actually knew that we didn't want to stay in Canada. It's not that Canada is not a good country, but we were looking for a place for the family. And that's why I say to you, Silke, that Germany actually had a lot of things for us as a family that we were looking for, like a family environment. And yeah, so then my husband actually got a lot of positions for him. But my area is physiotherapy. Although I have experience in public health, clinical epidemiology, I was looking something for me, for physio. And it wasn't very easy because physiotherapy is not a career, like a fashionable career in Europe. In North America, yeah, it's a very, very well recognized career, but not in Europe. And we were looking something for me because my husband said, okay, we want something for you because I know that you don't speak German. I can get a German position anywhere, but you will probably not have that opportunity very easily. And also because he said, I don't think that you can be at home. So we were looking for a physiotherapy career. And there was this opening in this university, and actually apply. I didn't have a lot of experience with the German, although my husband is Austrian. He doesn't speak German, he speaks Austrian, and Austrian is not really German. And we were communicating in English. But I say, well, I'm gonna try. I know that I don't speak German very well. I actually, very basic German, what I could learn very easily in the university, but very basic. But I say, I'm willing to learn. And I applied for this position. Actually, it took for a while, like 2 years, the process. I was telling you, Silke, that they asked me every single paper from my Grundschule that I thought, oh my goodness, this is kind of weird because in Canada,
just for the audience, maybe, you know, the primary school, they really wanted the primary school marks, so. Okay.
Yeah, in Canada, they never ask you for that. They only ask you for your university degree and that's it. So I have to ask all of these papers in Chile because I'm originally from Chile, all of my high school degrees and all of that, and compile everything together. The process was very long. And suddenly, the university here decided that I was the elected person, and then they say, okay, you need to decide whether you are going to move to Germany in less than 2 months.
With and family and all, and children, and you know.
So, and I have to say to my husband, okay, and my husband say, we go. So this is the way that I end up here.
So you came, and was it worth it? Tell me, what makes it so special? What makes it worthwhile? And you know, was it the right decision to jump?
Yeah.
Why?
Like, of course, this for me, when we think about the family, I think I was the most disadvantaged person in the family because fortunately my kids were small and although we thought that they would be very, very fast with adaptation, my daughter, yeah, she was really well, like, let's go to a new country. My son was really like, why we should speak German? I know how to speak in English. This is my language, why I should speak German? But I think it was worth it. Now we ask the kids, oh, how do you feel here in Germany? How do you find it? And they love it. We can bike every day to school. We can actually have this flexibility that I really appreciate. We have more family time. Although I say to you, I work a lot. My husband helped me a lot with my tasks because it's very demanding. I do a lot of research, and I was happy to hear that there are some possibilities to reduce the load, because here also I'm trying to reduce my load because I do a lot of research internationally. But what I would say is the social security that Germany brings is something that perhaps people who have not lived in North America doesn't really appreciate. Like I was in Canada. I think Canada is a great country, but we had to pay a lot of money for daycare, for school. University is not free. So the social security that Germany brings to the family, even for us, was kind of oh my God, the daycare is free, the school is free. We have lunch in the school for the kids. In Canada, the kids were eating sandwiches. I was like, oh no, this is, for us was something like something invaluable. Like I would say for me was something that I really appreciate because in Chile is similar to this culture.
Right.
For my husband is European, so then he really appreciates that.
But you haven't cut your ties to Canada entirely, right?
No.
Tell us about your special situation. You're still teaching at the University of Alberta in Canada, right?
Well, teaching, no, not directly, because I have, though, PhD students, master students, I have projects there, because of course, with this very fast move, I cannot, or I couldn't say, yeah, bye, I'm going.
Auf Wiedersehen.
Yeah, so I keep my ties. I do a lot of research with Canada, and also because I used to teach in the graduate program in Canada. So I keep my links with the graduate school there. So it's a rehab medicine, rehab science faculty. So I have several projects with the faculty, not only with my faculty with its medicine or rehab medicine, but also nursing, also dentistry, because my area is with the jaw. So I do a lot of research with people, not only in Canada. Actually, I am very fortunate to say that I have links with South America because I'm Latin American. And also I have links with Europe because I have, when I was in Canada, I have a lot of links with the people from Europe. So I do a lot of research with several people around the world. And I keep doing that because I really like research.
Right. And if you could, speaking of research, if you could give some examples what you are actually working on so that people might get an idea, who you collaborate with.
So as I say to you, Silke, so physiotherapists work in several areas, but my area is musculoskeletal disorders or musculoskeletal pain. So we work with the people with neck pain, low back pain, headaches, everyone who has an ache, we treat it. So unfortunately, musculoskeletal disorders are the biggest problem for this world. And these musculoskeletal disorders are located within the 10 worst disorders in the world. So normally we are looking for strategies to manage them, to perhaps get better strategies to look or to evaluate, to determine which people get better with this type of management strategies. So normally this is the way that we are kind of approaching musculoskeletal disorders.
But as Professor Berkemeyer said early on, it's all about people. So you don't do that just on paper, right? I mean, you, of course, do the statistics and everything, but at the same time, you do closely work with practitioners and physiotherapists, right? Don't you?
Yeah, so then, immediately when I was appointed here, we started with my program of research. We started to launch several studies here. So we work specifically with patients. So we provide some strategies for management, for evaluation. We get in contact with the patients. Also, now I'm starting to get more to know the people here in Osnabrück, with the clinicians, with the physicians, our colleagues as well. So then we are trying perhaps in the near future to connect with them more in order to discuss what we could do for the people here in the area, because our patients for our studies are in this area of Osnabrück and the Landkreis, so the rural area as well.
So your German will be, excellent in no time, right?
hopefully this is what I hope.
So you are doing a lot of research, you're doing a lot of teaching, you are a professor, a lecturer, I mean, this is a lot. How do you cope? Having 2 kids as well, and a husband, and some hobbies, I hope.
Yeah, I have. My student here is laughing, but I have a lot of help. So the first thing that I should say, my husband. My husband is my big help with the kids. Sometimes if I have to get some meetings, he kind of cover me. I have to pick up the kids in the morning. Unfortunately, I have to get up very early. I start at 5 o'clock in the morning every day. But also I have help. I have postdocs, PhD students here that they visit me. So Jordana is one of my students here that is doing an internship with me. They help me a lot with managing the projects, and this is a lot of help. Also the university here, so we are discussing ways to reduce the load, especially for teaching. I love teaching. Don't get me wrong, this is something that I'm really, really passionate about. But sometimes when you have to deal with so many projects, so many students around the world, because they help me to do a list of how many projects I have, how many students, and sometimes my husband say, how can you do that? It's so crazy. So yeah, it's a little bit crazy, but I have a lot of help, and I hope that I get a little bit of reduction of this teaching load. And then we'll be...
Okay. We also will bring you back at the end.